Congratulations to my graduating colleagues and to every person here who made it possible for all of us to succeed. Family, friends, and especially the faculty and staff here at the School of Public Health at Georgia State University. Wow, I've learned so much. I knew a degree in public health was a good idea, but thinking back to my first few days of classes, I realized I didn't know at the time why it was a good idea. My view at the time was typical of someone wanting a career in healthcare. I was focused on individual patient care and how to improve and manage individual health outcomes. Gradually, things began to click, and I gained a much broader vision of population-based medicine, a way of looking at healthcare that takes into account the questions, where did this person come from? What are the things in their life that contributed to how they got here? And what in their life was out of their control or influenced by our society or political climate? In my goal to become a primary care physician, I am incredibly excited about integrating population-based medicine with individual care. When I started the MPH program, I knew it would be part of a solid foundation for my future career. What I was not expecting was how much the program would teach me about myself and shape my views around underserved populations through reflecting on my own privilege. I learned about the way that race, class, citizenship status, and sexuality can all work to influence your standing in the world, the opportunities that are available to you, the way that you are treated by doctors, law enforcement, and public agencies, and ultimately your health and your life. I started to recognize how many forces in my own life have been instrumental in getting me to where I am today. In my classes, I studied the complexities of health disparities. During my thesis research and through my involvement with Health Students Taking Action Together and Mercy Care's street medicine team, I saw firsthand the reality of health disparity. Right now, on the streets of Atlanta, a short walk away, there are people living unsheltered, without the resources to seek help or change their situation. They live with mental illness, physical disabilities, and in fear of what the future holds. The street medicine team does the work that they do because they believe the health outcomes for the homeless population in Atlanta can and will be improved by the care they provide. The team has a passion and a drive for change. So I ask you all today, what is your passion? Now that you have this foundation in public health, how will you put it to work? How will you use your privilege? Because we are each here today as a result of our privilege. Access to education, friends and family, our amazing teachers, and an expectation for success. All of these factors have played a role in getting us to this point. I hope you leverage your privilege to make a positive impact in the world. So what have we learned? There's the obvious: data analysis, program implementation and evaluation, epidemiological methods, but we have also gained the knowledge and skills needed to earn our place in a global public health community of visionaries, thinkers, practitioners, and researchers who believe that health equity is possible. The School of Public Health has prepared us to enter a rich and diverse field addressing issues including tobacco use, physical and developmental disabilities, violence and injury, the built environment, chronic illness and infectious disease, and the list goes on, as you know. The field of public health is wide open to your unique contribution. We can all play a vital role in health and well-being, and we can do this through being gainfully employed and in a career that is deeply satisfying and rewarding. I hope you find your passion, and I hope you are able to apply it. So what do you need to make this happen? One thing I've learned is that I need help, and I need to be really good at asking for the help that I need. It's the relationships I've formed and nurtured that brought me to this podium today. I've pushed myself to reach out even when it's been uncomfortable, to find where I can connect, to professors and others, to both receive support and give it as well. Doors open when connections are made and relationships are nurtured. I'm so grateful to my mentors and to my family, and I'm happy to say that many of my mentors are still in my life and are here today. I have worked with faculty, organizational leaders, and community members, and know that I will continue to nurture those relationships, not just because it makes sense as a career move, but because it's what moves my heart and brings joy to my career. I hope you nurture the relationships that got you here, and the ones that you need to move forward. I would like to thank the faculty and staff for this amazing opportunity to speak to you all. I would also like to thank my friends and my family, and especially my wife, for their patience and unwavering support. It is truly an honor to be standing here with the School of Public Health faculty. Can we give them a round of applause? And all of the supportive family and friends. And above all, I am so truly honored to be part of such an impressive graduating class. Thank you.